Good morning. I'm very excited about the award of the Living Innovations Grant. I've spent the past 25 years providing support to people with disabilities, specializing in medical appointments. We have a great relationship with many physicians in the community who are dedicated to the people I support. Yet there are times that people need access to their physicians when the doctors just isn't available to see them, causing people to end up taking trips to large and busy emergency rooms or urgent care centers. The development of a mini clinic will allow more immediate access to medical services that are provided by medical professions who know the person and have access to all of their medical records. Several of the people we support have many doctors and other clinicians that are necessary to meet their complex needs. We collect all the information from physicians. Our nursing staff works diligently to make sure the information from each of the medical professions are well coordinated. A very exciting result of this grant is the building of an interdisciplinary team around the person. The opportunity for physicians and specialists to work directly together as a team will provide better coordination of care by building a circle of support around the person. I believe that direct access to medical services when needed, reduction of non-essential emergency room visits, and a team approach to providing medical care will significantly enhance the people with developmental disabilities. Thank you.
I also want to take a moment to acknowledge Riley Ritter from Senate of the White House's staff. I saw Riley when I came in. Oh, there she is. Thank you for being here today and being part of this and your support. Finally, we're going to close with the brainchild of all of this, Professor Elaina Goldstein of the University of Rhode Island. She has been with URI for about 11 years, but she has 25 years of experience in health policy on healthcare issues. And now, as of today, we know her as the director of the Living Right program. I want to call to everyone's attention, she has been for many years the executive director of the Roads to Independence project, which has been running for 10 or 11 years. And that project has worked towards systems change in support of the competitive employment for people with disabilities and promotion of employment first policy in Rhode Island. Professor Goldstein is steeped in healthcare policy. She not only has a law degree, she has worked in Washington, D.C. with the U.S. Congress and on the Committee on Aging for many, many years. She has deep knowledge of this subject. And I should mention one other piece here. These awards were about innovation, as I mentioned earlier, but also about integration of healthcare systems, and then about interdiscipline. That is, drawing together the strength of the university and partners outside the university to provide real solutions to real challenges and convert them into real opportunities. Without further ado, my colleague, Professor Elaina Goldstein.
Can you hear me? I don't even know how to make this lower. Oh, okay. I am incredibly humbled by today. It was a project that was actually intended for the private sector, and generally when that happens, a state university is not allowed to apply, because if a state agency can't apply, neither can a state university. They made an exception, so that kind of set us on our path. But I really want to acknowledge all of the people who are here today, that if they were not involved in a very intense 6-week period in which we crafted this grant, it would not have been as successful as it was. And two people are here that I would like, maybe if you could stand up, because I guess, yeah, Christina and Tanya, these are the co-chairs of the Cross Disability Coalition. Without the significance of going to people with disabilities and asking them how can we create a better healthcare system for you? And we got like a 2 to 3 page document on, and then they came to meetings, and it was really an incredible process to see the physicians and other providers listening, maybe for the first time, to people with disabilities to find out what we can do to make the system better for them. So I just really want to thank them for their time. And Sue Babin, are you here? Sue Babin works for the DD Council, which is where the Cross Disability Coalition lives, and she was as much of a help at getting them involved with us as anybody. So thank you, Sue. I also want to take the time explain that as much as this is a healthcare grant, it also is a workforce development grant. And one of the things that I think that we did that was probably a little bit different than most of the other grants was, as the provost said, I've been spending the last 11 years attempting to get people with disabilities into competitive employment and to help change our system in the state and work with employers and with the state. And that means that everybody who will be hired out of this grant, except for probably my staff, but everybody who will be hired in healthcare professions, and they will be hired in new community health worker professions, peer support people, will all be people with disabilities. And for a total, I think, of like 31 people will be hired that have disabilities working in the healthcare system, and hopefully having more people with disabilities be able to work in our healthcare system for the future. So. I'd like to introduce Rory from Access Rhode Island, and are you back there, Joanne? Joanne from Trudeau Center, 2 people that were incredibly involved in helping write the grant, very involved with me for the last 11 years on helping people with disabilities get employed, which will be they'll be still working with us on helping people with disabilities get employed. We also have some private sector people here that are going to be very critical in the grant. We have Dean from Nalari Health. Telemedicine is going to be a very critical portion of this grant. Zymedica, Jim from Zymedica. Zymedica is another Rhode Island company that's going to be helping us get we have to get these centers up and running in 6 months. So Zymedica is going to help us with that rapid change, because that's one of the key things that they do. I guess you mentioned all of the sites. We have Chris from Seven Hills. We have Tom from Access Rhode Island. I'm trying to think, is there anybody that I'm missing who is from any of this? Do I have any, Dottie or Donna from Cornerstone, or, no, okay, Generations isn't here. I just really want to say that this is going to this is a partnership. There is no way that we are going to be we weren't able to get the grant, and there is no way we're going to be successful without the partnership of all of the private sector, of the people with disabilities, of the providers, of the state agencies, to really make this happen. But I am incredibly encouraged. We have a wonderful partner in CMS. I have a great project officer, and I'm really looking forward to 6 months from now to have a ribbon cutting ceremony here, Tom, where we can all come back and see this place poppin' with people who are being served because of Living Right. Thank you.
Perhaps Professor Goldstein would be willing to take a question or two? Or anyone else, for that matter.
Oh, wait a minute, I forgot. Eileen Norton. I knew there was a
right there.
I know. Let me tell you, Representative Norton has been a I don't know, can I call her a fairy godmother of mine in the state for years. Without her leadership in the legislature, we would not have the Sherlock Plan, we would not have the Olmstead Committee, we would not have so much for people with disabilities in this state. Professionally to move forward and to go for this, and every time she sees something innovative, she sends it to me. Go for this, Elaina. Go for this. So I want to thank you from the bottom of my heart and for your mentorship. And sitting next to her is Professor Jim Prochaska, who is also going to be very critical in this grant. We talked about the interdisciplinary providers, but the other part of what Living Right is all about and the model is all about is creating an activated patient to help them change behavior, to be able to manage their chronic conditions. And Jim has been so amazing in the country and internationally of helping people stop smoking, losing weight, many things, and he and his staff are going to be very involved in helping the people with disabilities actually know what to do to change their behaviors, to manage their chronic conditions, which will be hopefully an amazing amount of savings for the state and the federal government. So, Jim. I really have to thank Dean Ron Jordan. Dean Ron Jordan is the Dean of the College of Pharmacy, in which I reside, and he also has been, he was praying out the kazoo for making sure we were going to get this grant. He was incredibly helpful during the process of getting the grant. I have some faculty at the College of Pharmacy who couldn't be here, who are also very helpful in us getting this grant, Steve Kogan and Paul Larrett. So I knew I was going to forget. Now do you have any questions? Yes.
Hi, Kristen Gourlay, Rhode Island Public Radio. I'm curious what kinds of innovation or what sorts of models will this program be testing over the next 3 years?
The model is actually from the theory of change is from a book called The Innovator's Prescription, which was a book written by a professor of the Harvard Business School, Clayton Christensen, and his colleague Jason Wang, who is a doctor. Jason will be coming out here, and we're going to be having a kickoff on Wednesday with all of our providers to how do we get this kind of change that we modeled this after, how do we get it moving? And so they have been doing it around the country for years, and they're going to be helping us with that.
Can you be a little bit more specific about some of the components of that model?
Well, there's the interdisciplinary team model, okay, which we've modified from like the PACE program to have an individual interdisciplinary team. And then this model where you're going to have an activated patient, which is to get them to be able to, again, might be able to ask Jim a little bit more about his model of change, to get people with disabilities to be able to manage their chronic conditions. And when you do those two things together, it creates an enormous amount of not only savings to the system, but a better quality of care for everybody.
So from a nuts and bolts standpoint, how does spending $14 million save $15 million? How do you get there?
They're spending, to be very honest with you, they're spending $14 million, but we're actually saving $25 million. The net savings, how they calculated it, is $15 million. So we're actually saving a lot more than they're spending.
And so how do you achieve that? Well, what do you do?
Well, what you do is that you look at the cost in the current Medicare and Medicaid program. And what we did, we're very fortunate here, we put together a linked database which shows all of the history of the Medicare and Medicaid claims for the dual eligible population over the last maybe 15 years. So we looked at that history. We targeted the most expensive types of diseases. One is Alzheimer's and one is developmental disabilities. And by targeting those two diseases, for one person in any given year, for an Alzheimer's patient, we'll hopefully be saving $25,000 a year, and for a person with developmental disabilities, hopefully saving about $7,000. And again, you heard them talking, not what?
Where does the hope come into play here? I mean, what does savings mean?
Savings means you're not going to have somebody go to an emergency room, which is very high cost. You're not going to have them go into the hospital. You'll be able to treat them in hopefully a facility like this, and through telemedicine, being able to instead of having to take somebody to emergency room. I think the DD providers were saying sometimes 3 or 4 staff have to go with somebody with developmental disabilities when they have an emergency happen. So you're going to save that money. So making it a more efficient system in addition.
One final question. I know various folks have to go.
In terms of the dual eligible population, about how much of that population will this grant impact? In other words, how much of that overall population?
I think there's 45,000 dual eligibles in the state, and to be very honest, the numbers of people with Alzheimer's and the numbers of people with DD, I think the DD population that's dual is about 4,000 in the state, and I don't, maybe Secretary Constantino has a better, or maybe Secretary Taylor, Director Taylor has an idea of how many people with Alzheimer's that are dual eligible in the state. I don't know. We're probably going to wind up servicing over the 3 years. If they give us another 2 sites, which they keep saying they're going to do, we're going to start with 2 sites, and then after a year, hopefully they're going to pay another 2 sites to start up. If we do all 4 sites, our expectation is to service about 1,900 people. If we only are doing 2 sites, which we're doing everything possible to get those sites up and show the savings, we would probably service about 950.
We're running a little bit behind schedule, so I'm going to sort of bring this to a close, but I know Professor Goldstein will continue to answer questions on an individual basis as to the media or anyone else. So thank you all for being here for this wonderful day for the state of Rhode Island.